Let's continue with part 5 of our training series, where we would like to explain you how to enter a new patient step by step. First, please log in at the ERKReg website and then click on Data Entry on the ERKReg dashboard. You see here the whole list of all entered ERKReg patients from your center, and then choose the button Add a New Patient. In the patient entry form, you can see that the patient ID has not yet been assigned. The ID will be generated automatically once the patient record has been successfully saved. If the patient is eligible for a sub-registry based on their diagnosis, you can enroll them by selecting the corresponding checkboxes. Once selected, additional disease-specific data fields will appear automatically. Please note, the ERKReg Informed Consent already covers the collection and use of clinical data for all sub-registries, so no additional consent is required for clinical data. Additional informed consent is only needed if biosamples are collected as part of our cohort studies, such as ComCure or ESCAPE-KT. The next section is regarding the healthcare provider unit. Please select whether you are entering the patient from a pediatric or adult nephrology unit. If your center has only one active unit, this field will be selected by default. The next section is about the informed consent. The first field is to the date of the written and signed informed consent. As explained in Chapter 4, all consent options selected by the patient must be transferred correctly into ERKReg, as they determine how the patient's data may be used in future research and analysis. Now we are entering the basic demographic information, including sex, date of birth, ethnicity. The next field is about the date of first sign or symptoms. This refers to the onset of the disease and not necessarily the patient's first hospital visit. In some cases, such as many acute conditions, the first signs can already be detected before birth during prenatal ultrasound examination. In these situations, a date before birth may be entered. If the exact date of symptoms onset is unknown, please review the patient's medical history carefully, and if you cannot be determined with reasonable certainty, please leave this field blank. The next field is about date of first presentation at your center. And as mentioned earlier, we only recommend to enroll patients with an established renal diagnosis. Now, how to choose the primary renal diagnosis? There are 4 different options how you can proceed. The first one is to browse through the hierarchical OrphaNet classification tree until you reach the correct diagnosis. The second option is to enter the affected gene, and all associated diagnoses will be listed, and you simply select the correct diagnosis. The third option is to search directly by the corresponding ORPHA code. And the fourth option enables you to find a diagnosis by typing its name into the search field. For all 4 options, it is important to confirm the diagnosis at the end. When entering diagnosis in ERKReg, it is important to distinguish between primary and secondary renal diagnosis. Here we have some guidance for you. If a patient has a genetically confirmed diagnosis, this should always be entered as the primary renal diagnosis. If no genetic diagnosis is available, the primary diagnosis should be the main renal diagnosis documented in the patient's clinical letter or medical report. In most cases, this is the first diagnosis listed. The primary diagnosis should always represent the patient's main structural or functional kidney disease, such as renal hypoplasia or renal dysplasia. Additional conditions that contribute to the patient's clinical picture can be recorded as secondary diagnosis. There's a special case for syndromic acute. The structural kidney abnormality should be entered as the primary diagnosis, while the underlying syndrome should be recorded as the secondary diagnosis. For example, the primary diagnosis would be renal dysplasia and the secondary diagnosis would be syndromic acute. If you are unsure which diagnosis should be entered as the primary diagnosis, please consult a referring physician at your ERKReg center before completing the patient record. The next section is about a diagnostic survey. Whether a diagnosis is considered confirmed depends on the type of rare kidney diseases and the available diagnostic findings. In some cases, confirmation is based on genetic testing or kidney biopsy results, while in others, the diagnosis may be established through imaging findings such as ultrasound or on clinical examinations by the treating physician. As a general guide, glomerulopathies are usually confirmed either by genetic testing or kidney biopsies. For tubulopathies, ciliopathies, and metabolic nephropathies, confirmation is mostly based on genetic testing. In thrombotic microangiopathies, diagnosis is typically confirmed through immunohistological findings and/or genetic results. For acute, confirmation is based on radiological investigations. In some cases, a genetic diagnosis may only be established years after the initial clinical diagnosis. In this situation, it may be appropriate to use the earliest clinical valid confirmation date depending on the available evidence. If there is any uncertainty, it is always recommended to consult a referring physician at your ERKReg center for clarification. If you select different methods, additional fields will appear automatically. These will request further details about the chosen method, such as the date of the assessment and other relevant supporting information. This ensures that all necessary context is captured in a structured and complete way within ERKReg. If you have performed genetic diagnostics, please start by entering the date of genetic screening, meaning the date the blood sample was taken. Next, use the drop-down menu to indicate whether a causative gene has been identified. If the genetic results are not yet available, select Pending. In this case, please also add a note in your internal Excel tracking list to ensure the entry is updated once results are received. Then, enter the date on which the genetic results were received. Please also specify the method used for genetic testing, such as NGS panel screening, exome sequencing, or any other technique. Afterwards, select the gene according to the inheritance pattern. Autosomal recessive genes will be entered here, autosomal dominant genes will be entered here. When entering the variant, follow the formatting exactly as in the example. Please do not repeat C dot or P dot in the free text field. Also, please use the 3-letter amino acid code when entering the amino acids. Try to avoid additional brackets or spaces in between. And if available, include the NM reference nomenclature for specific variants. We also have a field for additional comments on the genetics. Please write them in English. If a gene is not available in the drop-down list, this may indicate a newly identified mutation. In this case, please contact us at ERKReg so that it can be reviewed and added to the database if appropriate. Once all required information has been entered, please click Completed and then Save. At this point, the patient ID is automatically generated and the patient will appear in your patient list. Make sure to record this number in the respective medical record, on the informed consent form, and in your internal Excel tracking list. This ensures that you can keep track of which patient have already been entered into ERKReg and allows you to correctly link local patient information with the ERKReg patient ID. Since basic data entry is completed, we can continue with entering the clinical visit. To learn how to enter clinical visit data, please watch the next chapter of our training series.